Let us start from the basic introduction class. What is orthodontics and what are the different areas involved in orthodontics? And I will be showing you some cases also in the end so that you will know what type of treatments are going on in the department. Hope all of you are safe and sound during this pandemic. So post pandemic, probably I don't know when you will be back. Hopefully in a couple of months you should be back. So the basic today's we will be just briefing you about the introduction to the orthodontics and the different treatments which are involved in our department and the interdisciplinary areas. It is just when there is a treatment done, there is involvement of various departments. So you should be aware of that. It is not just one department which is involved. So the various departments are involved here. So I will just brief you what are the definition of orthodontics and the history. We will go into the history also a little bit. So if any absentees are there, so you can later the video will be uploaded. Hello Vishnu. Vishnu.
Yes, sir. Hello, sir.
So later this video will be uploaded there. Okay. So
Okay,
this
sir.
is the
Okay, sir.
definitions part and the important diagrams part. So now here you can just listen. Okay. No need to run around with the notes or scribble down the notes. It is difficult, I know, because I have been attending 250 webinars during this pandemic in the last 3-4 months. So I know how it is. It will not be clear and it will not be fair to be writing. We'll be scribbling fast. Okay. So the best thing is the post. You should evening or sometime when you find time, just so the coming to the history of orthodontics. So this is the man, the Frenchman Lee Follon. He has coined the term orthodontics. Okay, you can see there 1839. He has coined the term orthodontics. All the odontics is same, whichever branch you are involved. The odontics is the meanings tooth. Okay, X is science, Don's tooth. Okay, so the only your first part will change, whether it is orthodontics, periodontics, whatever odontics, all your 8, 9 subjects. Okay, in the final year. So remember that. So the orthodontics means the straight teeth. Okay. So this is of all your 9 branches which you have, orthodontics is the largest specialty. I'll tell you why in the coming slides. You will come to know why it is the oldest and the largest specialty. Okay. So the orthodontics being the first specialty of dentistry. Okay. So there are now we have a lot of information on the Google or various areas. So the diagnosis and the treatment modalities complete. There is a complete transformation of your diagnosis, the treatment modalities. So this was one of the oldest definitions. So we will not get into that. So you should know This man also must have heard already, the father of modern dentistry. Okay, Perry Forchard. Why I have shown him today is we have some relation with him in the orthodontic appliances also. Okay, so the orthodontic appliances, he has given one bandalet appliance which was the forerunner of all our orthodontic appliances. You can see that is Forchard's appliance, the design. See how initially it was there. So it's long back. You can see the very Forchard's tooth appliance, almost 1728. Okay, so it was so crude that time. Then we have a couple of definitions. You need to know at least one of these definitions. So the British Society, this is the initial definition which was given, which you will find it you in your practical books also. When you get your practical books, when you come to the labs, you will find this in the practical books, the British Society, and the more recent one. This is much better definition involving most of the issues. Okay, the AAO definition, that is the recent definition. Okay, British Society, you can see there, it's very old. The 1922 it was given, and the profits definition can see here. This is a much better definition. Okay, covering all the aspects. So one of these definitions you should have use after the in the evening or whenever you find time, at least in the weekends, you'll have to make some good notes out of it. So all the branches, you should be aware of the definitions. Okay. So the definitions, because there is a short question, 2 marks question, which is there. That is the define orthodontics. Okay. So you'll have to put this down in the 2 marks area. You'll have to write down the entire definition. Okay. And the meaning of it, you should be able to put it down. This was given in 1983 by William Profit. So let us look at the history of orthodontics, brief history of orthodontics. These are the pioneers. You will have the pioneers in all the subjects you will have. So the pioneers in orthodontics, William Kingsley, okay, Norman Kingsley, Edward Hartley Angle, okay. Kingsley is also called the father of orthodontics, Norman Kingsley, okay. This they will ask you sometimes in the Viva. So Norman Kingsley, father of orthodontics, a prolific writer, more than 100 articles. The most of his contributions are towards the cleft lip and palate. Okay, his works were on cleft lip and palate. You can see even in the 18th, early 19th century. Okay, so the father of orthodontics, Edward Hartley Angle. You'll have to remember this. You will find in the short questions what are the contributions of, what are Angle's contributions. You will see in that way, or you will just see the same, the full name there, Edward Hartley Angle. So you'll have to write about the father of modern orthodontics contributions. Okay, what are his contributions towards orthodontics? Okay, so Angle, the father of modern orthodontics. Okay, he has formed the American Society of Orthodontics. You can see as early as 1900. Okay, he has given the various appliances. I'll show you in the subsequent slides. So the Angles era, you can see the father of modern orthodontics, various photographs. The Angles first contribution is the edgewise bracket. He has given the edgewise bracket, that is which fits the rectangular wire. Okay, the rectangular slot which has been given. Okay, the edgewise bracket, you just remember edgewise bracket, that is more than enough at the undergraduate level. Okay, So the Angle School of Orthodontia. This is the first school in the world. Okay, you can see it is more than 100 and almost 120 years old. That is why I told you orthodontics. This is the oldest and the largest specialty. So the American Society of Orthodontics that is formed is 1901. Okay, so the father of modern orthodontics. So the ribbon arch he has given the ribbon arch appliance. Okay, Eka, hello. లేక ఏంటమ్మ ఇది అప్పుడే టైం అంటుంది అప్గ్రేడ్ అని కొట్టాను
ఓకే సార్
ఓకేనా అప్గ్రేడ్ అన్నాను
ఓకే సార్
సారీ ఫర్ ద టెక్నికల్ ప్రాబ్లం సో he has given the ribbon arch bracket, the edgewise bracket, then the pin and tube appliance. This is a landmark appliance in orthodontics. Okay, most of the appliances which you have are all from these appliances which the father of modern orthodontics has given. Okay, see these appliances, these are the appliances you should be able to remember couple of these at least. Okay, the edgewise bracket, the pin and tube appliance, some of these things you should be able to remember. Okay, so the angles after these contributions he has given the most important landmark, the angles classification. The angles classification he has given in 1899. Okay, so this is very very important. Even today there are a lot of classifications. In the subsequent diagnosis chapter we will get into the classifications, and the diagnosis chapters we will get into the details, the modern classifications, the recent classifications of in the year 2019 also. But this is still this is used, the angles classification of malocclusion, which is given in 1899. So Calvin Case, he is another pioneer in orthodontics, one of the greatest pioneers. Okay, he has so many firsts. He has used the elastics for orthodontic tooth movement. He was the first to use elastics. Okay, and he is the first to use the gauges to measure elastic forces. Okay, he has used small gauges to measure the elastic forces, and is also pioneered the use of retainers. Okay, so the case, there are some, this is also a short question. Okay, the case angle debate. Angle, Edward Hartley angle was for non-extraction therapy, whereas case is for extraction. Okay, in orthodontics, what the tooth which we extract, all of you know what are all the tooth, the tooth which we extract usually they are the premolars. Okay, either the first premolar or the second premolar, depending on your space criteria and the space analysis. Okay, so he was also criticizing angles classification because there were drawbacks. Okay, angles classification only considered one plane, whereas in orthodontics we are very much concerned about the three planes. Okay, so the entire orthodontic treatment we have to focus on three planes always. Okay, the sagittal or anteroposterior plane, then you have the vertical plane, then you have the transverse plane. Okay, so these three planes you should consider always, whichever chapter we are into. So the face, you can see the facial appearance is the most important thing for the patients who walk in. The aesthetics, they are concerned about the aesthetics. But as an orthodontist, we have to focus on various other things also. Okay, the functional stability. Okay, So this is the recent change. Okay, this just see this the face focused. Orthodontics is now face focused, not just the intraoral. Okay, angles time it was just the intraoral. He was only bothered about the dentition and the alignment of the dentition. What he says is, if you align the dentition, automatically everything will be fine. Everything will fall back into place normally. Okay, but that was proven wrong. The later cases proved that extractions have to be done. So now also we do extractions. Almost 60% of extractions are being done. So the face focused approach, you can see here that this is a recent things. Okay, the face focused approach is a compromised airway can be associated with TMJ problems, headaches, and sleep apnea. I'll tell you later why the airway is important, why orthodontist is bothered about the airway. Okay, so this name you will have to remember this name, the Jackson's triad, the aim of orthodontic treatment, the Jackson's triad, the structural balance, the functional efficiency, and the aesthetic harmony. Okay, those are the aims of orthodontic treatment. Okay, the structural balance, functional efficiency, and aesthetic harmony. So the Jackson's triad, you look at the triad, this is the original triad. Initially, it was just the hard tissue, the paradigm. Okay, there are shifts based on each century. Okay, the hard tissue paradigm during the Angles era. Okay, then later it has moved to the soft tissue. Now the soft tissue is plays a very important role. Okay, so the micro, mini, and macro, mini, and micro aesthetics. Okay, this we will get into the details when we come into the diagnosis chapter. Okay, so the Jackson's triad, this is what I was telling you just now. See, the airway is very important. Okay, why? Because the orthodontic treatment recent focus in the last 10-15 years has shifted to the airway because there are airway changes. Airway has improved. Okay, correcting the obstructive sleep apnea. Okay, where will you find obstructive sleep apnea? In the mouth breathing, in the various habits. Okay, you will come to know that slowly. So the Jackson's triad, see the airway. Airway is very important. Okay, once you correct the malocclusions, different malocclusions, there has been lot of changes in the airway, which has done a lot good things for the orthodontic patients. Okay, that is why the focus is there now on the airway. It is not just your Jackson's triad. Okay, it is a much broader aspect. That is why we call out the department. The name of the department is orthodontics and dentofacial orthopedics. Okay, the entire face, the head and neck, till the head and neck. Okay, so we have the evidence also. So whichever subject you will have to talk about evidence. Okay, things have changed even at your undergraduate level. You should be able to read some journals, at least, if not the specialty journals, at least you should focus on the evidence-based dentistry. So at least weekly, once or twice, you should jump into the library. Okay, just see that evidence-based dentistry. So you'll find lots of things about the all the 8 subjects. Okay, so the airway, this is your evidence. Okay, so the airway, then the focus now shifted to the patient. Okay, patient is the prime factor. The current evidence-based orthodontics, if you come into the evidence-based orthodontics, the patient reported outcome measures are very important. Patient is the prime factor. all your research is focused on the patient, for the benefit of patient and for the community. Okay, remember this, dear students. You will have to, you can start small projects even now in the third year you can start. Okay, so in the Jan again, this ICMR projects will start, students projects. So you can just log into the ICMR website. Okay, since you have now enough time at home, you can just log into the ICMR